Glad to see you guys again. This is Dr. Jonathan Goodwin, your cardiology concierge, here to try to help bring a little bit of sunlight into the dark area that what is heart disease. So in our first video, we talked a little bit about just who we are, what we do. So in this one, I wanted to get to one of the topics that seems to cause a lot of anxiety to a lot of people. You've just been told that your furry friend has a heart murmur. That usually right there makes a lot of people poop their pants. Just heart murmur, But first, let's talk about what an actual heart murmur is. All a heart murmur is the sound of turbulent or uneven blood flow. What do I mean by that? Best example I can think of is you think about a water hose. If you have a water hose, you turn on the water. Water coming through the hose makes a sound. Now, if I go and I take that hose and I put a kink in it, it changes the way the water sounds as it flows through the holes. Or if I go and I put my thumb over the edge of that water hose, it changes the way the water flows through and it changes that sound. When we say we hear a heart murmur, we're saying we're hearing a change in the way blood flows through the heart. Now, what is that change? What is it? What could it be? There's a lot of things it can be, a lot of different things. And we can start to go over that a little bit more. But the key is the murmur is more like an alarm than it is a disease. The thing you always want to remember about these heart murmurs is they're telling us something's going on. They just don't tell us exactly what's going on. So one of the things you'll often get told by your veterinarian when they listen is they'll put a grade on the heart murmur, what it sounds like to them. They usually will grade these murmurs out of a score of 6. And they'll say, oh, your baby has a grade 2 out of 6, a grade 6 out of 6, a grade 4 out of 6. What are they really saying to you? That 1, 2, 3, 4, 5, 6 is really grading how loud the heart murmur is. Not how bad, but how loud the murmur is. So just because the murmur is louder doesn't mean the disease is worse. Or just because the murmur is softer doesn't mean the disease is better. If you were a firefighter and someone came to you and they said, the smoke alarm in my bedroom is going off and it sounds like eep, 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 eep. But what I'm really worried about is the smoke alarm at my office is going off and it sounds like So which fire should you fight first? Well, first of all, as a firefighter, you'd be less concerned about the alarms and more concerned about, is there a fire at all? And that's the question I'm really bringing up. The murmur just says there's a change in blood flow that if we were smart, we investigate it to see if there's anything that's significant going on at all. If there's nothing significant going on, we keep rolling. If there is something significant, okay, we lock and load, go do something about it. So it makes it really, really an easier way to transition and go, as opposed to being just terrified because someone said they heard this noise. Again, the big thing, just human nature, people tend to think if the heart murmur is graded higher or the murmur is louder, that means the disease is so much worse. Or if the heart murmur is soft or it's been graded a lower number, it's so mild you don't have to worry about it. We don't really want to do either one. If we hear an alarm, we want to go and see why there's an alarm. If your smoke alarm in your kitchen's going off, whether it's loud or soft, typically you'll go walk in the kitchen and see, is somebody burning the toast? Or if the whole pot roast is on fire. We just want to know and get an idea. That's all we're really looking at. In terms of the murmur itself, it's this change in the way we hear the sounds of the heart. It tends to have a little bit more of a brushy sound to it. So if your normal heartbeat's the murmur tends to sound like a and that little brushy sound is just the sound of a little bit of turbulence or water or blood flowing not as smoothly through the heart. So again, next time you're told your baby has a heart murmur, don't get terrified. Take a breath. We got this. And let's go see and investigate why it's even there. This is Dr. Goodwin, your cardiology concierge, coming to you once again. Please hit that like or subscribe button if you want to hear more content like this. I know that button's somewhere around here. One day I'm going to find it. All right, we'll catch you next time.